Hey guys, I'm Jonathan. I work here at Axis Dental Milling in LaGrange, Georgia. I'm going to be the voice behind the camera today. Let's go inside. Let me show you a little bit of what we do on a daily basis. Alright, this is Axis Dental Milling. Over here we got our accounting and our sales department. I think these gals are out to lunch. Got Sean and Kathleen hanging out over here in our design department. Matt's hiding back over here in the nesting department where I work. Got some guys over here in finishing and sorting. Doug, Marta, and Eddie, they're some of our finishers. Carlos is hiding over here in the back. He actually takes our units that are manufactured and takes them through the rest of the process to get them ready to go into the furnace room. And then here is our mill room. Got all sorts of different types of milling equipment in here. Take a peek inside one. These are essentially specialized CNC milling machines. Hey Matt, I heard you're having a milling problem.
And I've got no milling problem.
Since it's kind of hard to see what's going on inside the mills, here's a virtual representation of what those CNC mills are doing. And here it is sped up much faster. Perfection. Big pile of unsorted crowns. Got all sorts of teeth here. Sean, what are you over here working on?
Essentially, we're just going through, checking the quality of all the teeth and separating them and getting ready to ship out to each of the individual companies.
Thanks, sir. Hey, Doug, what you working on?
Working on a framework, man. Trying to get it done.
Show these people what you're working on. Nice.
Like this. And then there'll be porcelain built up over this framework. And shaped in the teeth.
This is Kathleen. She works in our design department. She mans all the 3D scanners that we have in the lab. And basically what she does on a daily basis is she takes all the models that come in from all of our different laboratories all around the country, and she gets those scanned in 3D. Kathleen, show us a model that you've already scanned in.
Here. We scan the working model first, and then we will scan our opposing models. Then we scan the die separately to make sure everything lines up together. And then if everything looks good, I send it on so it can be milled.
There's like a preliminary scan of what the 3D scanner will do when you start scanning in those models.
Everything in red is what we want to capture.
All right. Thanks, Kathleen.
Thank you.
On back again. So Sean, after Kathleen takes and scans those cases with our 3D scanner, what do you do with them?
What's next is basically to design the case for to basically work with however this model is. Essentially, I'll get one of these models here, As you can see, it's got the different removable dies. I've got to create a bridge that's going to work and mesh with all the remaining teeth that this patient has. Essentially, here's the program right here. As you can see, I've already gone through and designed the bridge for this case. There's a few little tweaks I still have to make to it, but essentially I'm going through just making this the best way perfect to fit in that patient's mouth, that there's not going to be any kind of issues. Especially with us, it's all about quality. Getting these to look almost like you couldn't even tell that it's a fake tooth inside there. So essentially this is the program here. We have all of our different tools that I can use to do whatever it is that I need to do on this one. If I need to come in through here and add something like a large bump there, we've got tools to do every little bit inside here to make this perfect. But essentially what this program does is it's going to give me a base anatomy of the tooth. Essentially you have to sit there, put it in there, get it to the right size, get the right shape to it, and get it to work for that personal patient's mouth. This is different every single case.
So you CAD CAD guys out there, this is where that additional CAD experience comes in. If you've got any experience, it can translate directly over into this type of technology. Matt, he works with me in the nesting department. Matt, what are you up to?
Right now I'm finishing up a disc that I was working on. All the teeth are already nested. I'm just going by and referencing them. Then I'm going to finish and load them up in the mills.
Okay, awesome. Yeah, we get files that come in over the internet from other laboratories that design their crowns, and then we also have crowns that we design in-house. They come over to our department, and we're the ones that physically load them into the zirconia pucks that we use and get those manufactured. All right. Thanks, Matt.
Have a good one.
The materials that we work with on a daily basis. This is zirconia. This is pretty much the lifeblood of our industry. If you've gotten a crown or bridge put in your mouth anytime in the recent past, I guarantee you probably had some zirconia in it. Another type of material that we use here, this is called PMMA. It's a bioavailable and compatible plastic material that dentists regularly use for putting temporaries in your mouth before in the time between having your permanent zirconia crown placed. And then also here at the lab we use 3D printing technology, so we can actually 3D print our own models, which helps our finishing department make sure that those crowns are seated perfectly so it's a perfect fit in your mouth. Everybody, this is the man, the myth, the legend, Matthew Barrett, owner of Axis Dental Milling, and appreciate, Matt, you taking the time to answer a couple of questions that the community's got about the dental industry. Let's get started with, to you, what's the role of a dental lab technician?
So the purpose of a dental lab technician is to manufacture or custom manufacture parts, crowns, bridges, implants, all these things for a dentist. So a dentist would take an impression of somebody's mouth if they needed a crown after they ground the tooth down, send it to a dental laboratory. The laboratory would then process and make a crown to send back to the dentist.
You know, but most of the rest of the people don't know, we're actually a milling center. So based on what we've shown everybody today that we do, what's the difference between a milling center and like a traditional full dental laboratory?
So we're a middleman that works for the laboratory. So laboratory would get a patient's case in to make a crown and need a specific product or part. And when that happens, they will turn to somebody like Axis Milling, find us and say, hey, can you guys mill this particular thing for me? Yes, we can. And then we would manufacture the parts for them.
About the kind of qualifications that are needed and sort of desired skills that this industry looks for.
Well, there's a lot, and the industry's changed a lot, from lots of hands-on, so a lot of dexterity. A lot of times people with art backgrounds, anybody that's good with their hands would do well in dental laboratory. Now with the introduction of CAD-CAM, and for years now we've started using CAD-CAM milling machines and 3D scanners.
So someone who has prior CAD experience or anything with machinery, CNC, or just maybe someone that's really good at problem solving and just knows computers real well.
Yeah, absolutely. There's a mix now. You know, and there are lots of places to be involved in the lab because you have the computer side, you know, people who are good working on computers and know softwares, and then also people who are good with their hands. There's a little bit for everybody, really. And basic knowledge, there's not many schools out there anymore. There used to be some in tech schools. There may be a small handful, but a lot of it is going away. So I personally think that the best way to learn is to find a laboratory and learn the trade. These days it shouldn't be hard. In fact, most people don't realize it, but in their town, somewhere close, is a dental laboratory. And whether it's in a guy's basement or he's in the top building, you know, the top floor of a pizza place on the square in their town, there's a laboratory somewhere. Those dentists are getting crowns from somewhere. Most of the time there's a local guy. It's just very unheard of.
This industry, you know, people that are interested in getting in, we know in the past that, and, you know, it was pretty closed doors, and a lot of the old school secrets were never shared, and that situation's kind of changed. Can you tell us a little bit about that?
Yeah, I mean, really there's a age gap. For the majority of our clients now are only somewhere around 60 years old. And there's a gap because most people who work here at Axis, we're early 30s. So, I mean, in between those years, there's nothing. So, really, to get into this industry, you would want to find one of those guys that has this knowledge, you know, to learn this trade. And that would be the biggest way, I think, the fastest way to get into it. And I think that those guys now are looking for people because as they get to the end of their careers, a lot of those guys don't have somebody working there to turn this over to. And it is a very good industry. It's a lot different. It's changed a lot in 10 to 15 years. It's a massive change, and the change is more towards, you know, digital. You know, everything's going digital. Doesn't mean there's not work out there. It just means that it's done in a different way. And
So if somebody wanted to get into dental milling or becoming a dental lab technician, do you think maybe the best thing to do would be to get on the internet and do some Google searches for dental laboratories and dental milling centers that are nearby, and maybe just make some phone calls to those owners and start a dialogue maybe?
absolutely. I mean, really, what those people are out there and what they're looking for are guys that are go-getters
And gals.
and gals. Oh yeah, of course. And so they're go-getters, you know, people that there are, just like any industry, stresses in this industry. It's a timely thing. And we have to be timely. There are people, we're not making a plastic fork that somebody needs to use 6 months from now. You know, we're making things that people use in their bodies and that they need for a lot of reasons. One, they want to eat. Two, they want to look good. So, and it's important to people.
At the end of the day, I mean, what's the big takeaway for you personally? I mean, why are you in this industry? Why have you stayed in it as long as you have? What's the big motivator?
This industry demands hard work, and I like to work hard. It makes the days go by. I like to enjoy what we're doing, and one way that I think that I really do that is knowing that we're not just making products that are going to sit on a shelf. We're making things that will change people's lives. You know, there are people that have had problems their whole life with their teeth, and a lot of people don't understand what that does to somebody. And to have a dentist call or a laboratory owner call and say, hey, this specific patient, we redid their entire mouth, and they looked in the mirror and they cried because it's going to change their life. You know, they're going to. There's tons of great things that come out of that. You know, and that's what we're here to do. You know, we're really here for those people, and that's what this industry does.
Well, Matt, thank you so much for taking the time to stop and give these folks some information. I'm sure they greatly appreciate it. And let's get back to work, man.
Absolutely. See you guys.